patient presented to our office with severe pain and inability to chew on her left side. You can see, the bone level is marked by the red arrows. Bone was still low and the implant infection is very clear. Clinical photo of the implants showing the implants metal, the inflamed gums, the cement, and the deposits.
Done here? Add bone or just place short implants? Well, the studies we found are suggesting that short implants are more successful and have less complications than bone grafting. Short implants have proven to be a very successful alternative to replace teeth in atrophied mandible. The success rate based on this systematic review is more than 98% in most of the cases.